Well, good morning. We'll go ahead and get started with the COVID-19 and vaccine update. More than 1.7 million doses of vaccine has been administered in Iowa, which is 83% of all doses that have been delivered to our state, ranking us 10th in the nation. 44% of Iowans age 18 and older have received at least one dose. 87% of individuals that are 65 and older have had at least the first dose or one dose, and 28% of Iowans are now fully vaccinated, which puts us about 9th in the country. So this is another milestone week in our state. Vaccination is now open to all Iowans. Those 16 and 17 years of age can receive the Pfizer vaccine, while those 18 and older are able to have any of the 3 vaccines currently authorized for emergency use in the United States. Also this week, we have received our biggest vaccine allocation to date, 160,770 total doses between those that have been sent to the local public health departments and pharmacies that are participating in the federal vaccination program. Included in that allocation are 45,800 doses of Johnson & Johnson vaccine, and that's almost as many doses this week than what's been administered in total since it first became available. Those Johnson & Johnson doses will allow us to continue the remaining employer vaccination clinics, begin vaccinating college students this week, and support our local public health department's efforts to vaccinate hard-to-reach populations. However, the White House COVID response team did inform governors yesterday that we are going to see a significant reduction in J&J doses next week, and that we should expect lower allocations until the end of the month, when the weekly supply should increase to 8 million doses nationwide, so 2 weeks of reduction in our J&J doses. Until then, we'll adjust our plans accordingly over the next few weeks, but J&J will continue to be allocated for college vaccinations and others who may benefit from a single-dose vaccine. By doing this, we're ensuring college students and young adults are vaccinated as soon as possible, and that will help keep the virus activity low and manageable until a higher percentage of Iowans are fully vaccinated. Much of the recent uptick in positivity cases, not only in Iowa, but we're seeing this nationwide, can be attributed to individuals that are 18 to 24 years of age. And while many of them will experience only mild symptoms, they risk spreading it to others, including older coworkers, family members, or their parents who could become seriously ill. In fact, the highest percentage of current COVID hospitalizations is now often among adults in their 40s, 50s, and 60s. 61% of all Iowans currently in a hospital for COVID treatment fall into those age groups that I just mentioned. While hospitalizations remain stable overall, the demographics of those needing to be hospitalized have shifted from older adults to middle-aged. Fortunately, a large percentage of Iowans 65 and older have now been vaccinated, and we're seeing, as we talk about every week, positive results because of that. But the vaccination rate among middle-aged adults is lower. We're just seeing 35% of Iowans in their 40s and about 39% in their 50s have had at least one dose of vaccine. So now that the vaccination is open to all Iowans, we have an opportunity, and really we have a responsibility to change that. So I'm asking Iowans, if you're comfortable, please take the first vaccine that's offered to you rather than wait for one that you believe is better than the others. Every one of the vaccines, they are safe and effective, especially at preventing serious illness that can result in serious hospitalization and death. While we're still on the topic of vaccination, I want to address an issue that's getting a lot of attention, and that is vaccine passports. Since the start of the pandemic, I've consistently put my trust in Iowans to do the right thing rather than demand or mandate it, and vaccination is no different. While I believe in the efficacy of the vaccine enough to get it myself and encourage Iowans to do the same, I also respect that it's a personal choice. But I strongly oppose vaccine passports, and I believe that we must take a stand as a state against them, which I intend to do either through legislation or executive action. I will also continue to do my part to educate and encourage Iowans about the importance of being vaccinated. But as I said, we will take action either through the legislature or with executive action against vaccine passports. Even though vaccination is now available to everyone, targeted vaccination outreach will continue to promote confidence and equity among some communities that may be less likely to be vaccinated. That includes minority and immigrant as well as refugee populations. In Iowa, approximately 200,000 individuals identify as Hispanic or Latino, making this Iowa's largest ethnic minority population. According to a recent analysis by the Kaiser Family Foundation, a number of unique access barriers may be preventing Hispanic and Latino communities from seeking vaccination, whether due to confusion about eligibility, vaccine cost and insurance coverage, or potential language barriers throughout the process. According to the report, outreach efforts within these communities, it can truly make a difference. The survey data shows that 6 in 10 Hispanic adults say that they don't have enough information about where and how to get the vaccine. So proactively communicating that the vaccine is free for everyone, regardless of insurance, being clear that getting vaccinated will not affect immigration status, and helping navigate the process from start to finish will have a positive impact. But how this information is shared is just as important to be the most effective. Communication with community members should be done by trusted messengers and in their own language when necessary. So as the states work to ensure vaccine equity among minority populations began, we connected with organizations that already have trusted relationships established within their communities. And one such organization is Salud in Storm Lake, a multicultural health coalition that's dedicated to achieving equitable opportunities for the health and well-being of the entire community. So today, I'm pleased to welcome Emilia Marroquin, a Salud board member who's been working with my team, the Department of Public Health, as well as local public health and Hy-Vee, to coordinate a Hispanic and Latino community vaccine clinic in Storm Lake. Emilia, thanks for joining me to share more about the importance of serving all communities in a way that recognize their unique needs. And so with that, I turn it over to you to give us an update.
Good morning, Governor. Good morning to the audience. My name is Emilia Marroquin, as she mentioned. I'm from Storm Lake, Iowa, and I'd like to thank the Governor's office for inviting me to this important discussion. I'm here representing Salud. As the Governor mentioned, Salud is a nonprofit organization, and it's mainly composed from community members, who we try to shape response to community needs. In reality, our focus is engaging in inclusive practices, such collecting feedback from the people in the communities we serve. At the end, what we're looking is the well-being of all. As you know, we have mentioned Storm Lake is highly diverse. It's a highly diverse community home with many different cultures, and the needs of each community must be carefully considered. When it comes for, like any type of health care, including vaccination for COVID-19, we need to be very responsive for that. Right now, Salud is working with local public health department and Hy-Vee to hold a vaccine clinic to serve specific ethnic communities. We are truly believers that we have different communities, and each community must be treated in the way that works for them. Let's think about it. Each community is unique and different. Education, yes, is very important. And it should be occurred within the communities from trusted leaders and organizations that they are familiar with. That is a very important piece. And yes, mass vaccination happens, but not always works. We need to adapt, to their values, their beliefs, and make sure that works for all, not only for one group or another one. So Salud right now is, is hosting Hispanic and Latino community vaccination clinic coming up on Sunday, April 18th. If anybody from Salt Lake, April 18th is going to be a day that we're going to have our clinic for Latinos, and we will be helping individuals to set up appointments or any questions they have. So let's just remember, local health departments cannot do this alone. We need to create healthy communities, yes, but community participation and community engagement can make things much easier. And it's very important to ensure that the trust of the process and information they receive needs to be very, very clear and valued. So just please take the time and make sure that everybody in our community gets vaccinated. But again, we need to give them the information they need. So the next message I'm going to do is going to be in Spanish because I feel like I'm representing an important piece of Iowa, which is Latino communities, and I think they need to hear information also in their language, which is Spanish. So le quiero decir a toda la comunidad hispana que, por favor, no lo piense más. Llame, regístrese para recibir su vacuna contra el COVID. Las vacunas del COVID son gratuitas para todos, sin importar su estatus migratorio. Puede recibir la vacuna sin costo alguno, tenga seguro médico o no. Amigos, por favor, el COVID es real y es devastador, lo sé por experiencias propias. Y no queremos seguir perdiendo más seres queridos. Su vida es importante. La vida de todos es importante, así que por favor, infórmese, vacúnense y combata el COVID. And to all communities out there, please, get informed, get vaccinated, fight COVID. That's all I can say. Thank you, Governor, for having me, and thank you for the audience.
Oh, thank you, Amelia. I want to thank you and the entire board at Salud for lending really your expertise and your experience to this process. They've kept updating me on the conversations that you've had. I think it's very important that we take the right steps to ensure vaccine equity across the state, and I just greatly appreciate your effort in helping us get that done. And just a huge thank you, and I'm hoping I can make it to the clinic. So thank you for being a part of it.
You're welcome. You need to see what is the true reality.
Sounds great. I'm also pleased to report that we are making progress. We're monitoring administration rates among Iowans who identify as Black, Hispanic, or Latino, and Asian. And when we're comparing those rates to the most recent census data for each specific population, and in addition to the total population of Iowa. So from March 24th through April 5th, when looking at each specific group, the vaccine rate among Black Iowans who had received at least one dose of vaccine increased from 8.3% to 11%. Among Hispanics and Latinos, it rose from 8.6% to 11.7%. And among Asians, it went from 12.2% to 18.7%. So we still have work to do, but these results are very encouraging. And I think with continued focus in this area, and honestly, the strong community partnerships, we're involved in some of them, but we're actually seeing those take place all across the state of Iowa, and we're just offering assistance wherever we can to help facilitate that. But I look forward to seeing those numbers continue to improve. So this week is National Public Health Week, and perhaps now more than any other time in recent history, this observance should be elevated. For more than a year, public health has been in the spotlight on both the national and global stage, and for good reason. Throughout the pandemic, public health professionals have guided us through one of the most uncertain events in our lifetime. They have educated, advised, coached, and counseled us. Public health teams cared for their communities. They developed strategies at the state level and partnered across the nation, all with a common goal of making communities and Iowans safe and healthy, which is why I think that this year's Public Health Week theme, it's absolutely perfect. Building bridges to a better health. Because the work of public health is bigger than COVID-19, it's about what they've always done every day and every year to support better health outcomes for the communities and the people that they serve. Today, I'm pleased to welcome a very special guest who's had a storied career in public health. For nearly 40 years, Louise Lex has served as health planner for the Iowa Department of Public Health, assisting counties with developing their community health needs assessments, and health improvement plans. And at 91 years young, she is still part of the Iowa Department Public Health team and contributing to the health and well-being of our state. So Louise, thank you so much for joining us today. Share your story of how public health has always built bridges to serve our state and its communities. Louise?
Well, thank you, Governor. That was a good introduction about public health, and I appreciate the opportunity to talk a little bit more about what we've been doing. As you mentioned, I've spent almost 40 years in public health, and I have just never seen anything like this in terms of people becoming more aware of what public health is doing and appreciating what they have been doing in the last year or so. Unfortunately, or maybe fortunately, that has come with a shot. But that shot is, of course, extremely important in terms of preserving our health and continuing our good work in public health. The period from March 2020 to March 2021, sometimes called the COVID year, is probably the longest year any of us have ever lived. During that time, as the governor mentioned, public health has been very active, involved in educating, informing, verifying, doing all the things that we've been doing for a long time, but with special emphasis on COVID-19. When the vaccine became available, they really went into high gear. They found places where they could immunize folks. They organized volunteers. They did all kinds of things that made this immunization process possible. I think a couple of examples might be helpful. You mentioned, for example, our outreach to minorities, ethnic groups, and we've seen that again across the state. Probably one of the best examples is Polk County. They took the vaccine to places where people could access it, and I think that's important. In Greene County, people went to the casinos, and this time it wasn't for gambling, but rather for vaccination. 1,200 people were vaccinated in a matter of 6 hours. I think that's a pretty good record. In Webster County, there were, at least that's what I've been told, that the county mobilized just about everybody in terms of their efforts. So, just to mention these three counties, there are many. In fact, I'd say something is happening from every single one of the 99 counties, and we can be grateful that the activity is progressing as well as it is. We didn't do it alone, and I think Amelia highlighted this in her presentation, because simply public health has got to be connected and collaborating with many groups. And the thought comes to my mind about one example, and that is Fayette County. In Fayette County, there were 40% of the adults who were obese. They took that seriously and mobilized libraries, police. One of the things that we've been really emphasizing is the 5-2-1-0 program, which is very simple. Fruits and vegetables, spending less time on sedentary things, computers, getting a little exercise, and for heaven's sake, stop drinking sugar drinks or drinks with sugar. Basically, what we're trying to say is make healthy choices easy. And I think that's really the message that's coming through in places like Stewart County. Now, Iowa has had, I think, a long tradition of working together. And what I think symbolizes this more than anything else are the old barns and the fact that farmers helped other farmers. Without them, we today would never have those barns that I think are sort of a reminder of where all of us have come from. And this is all over. Public health is still going to be doing a good job. In fact, I think it may be doing a bigger job because the data that we're seeing is that suicides have increased, that there are more deaths from opioid addiction. And one of the most recent studies showed that young women, high school-aged women, 26% of them have considered suicide. Now, that's pretty disturbing. So mental health is going to be a big concern after this COVID-19 abates a bit. We also know that in public health, other things have a big impact. For example, we need better housing, and the governor has done a big job in supporting this. When we're talking about affordable housing, reducing poverty, good job of doing things that address inequities and racism. Food insecurity, we've got to do something to make sure that kids especially eat well and eat balanced diets. These are upstream problems that contribute to chronic disease. So these are the things that we do not think of as public health, but they are. And they require the community to come together to work on them. It can't be done alone. It has to be done as a community effort. I would like to pay attention and perhaps a tribute to the people, the women and men, who have been involved in public health, not only today, but in past years. And that, of course, included my own mother, who was a public health nurse. These folks have devoted their professional lives to babies, making sure these babies become healthy people. These young people who can be really trapped by tobacco, opioids, and alcohol. And then finally, the older Iowans, like myself, who can live in dignity in healthy communities. Thank you, Governor.
Louise, thank you so much for everything that you do, and thanks for that recap of all of the work and issues that you work on through local public health. And I love that you were able to cite specific counties. We have 99 of them, and some of the programs that you've been working on with some of those counties. So thanks for all that you do and continue to do to serve the people of Iowa. We greatly appreciate the role that you play in improving the health and well-being of Iowans, and I hope your story continues to inspire others to meaningful careers in the field of public health. And finally, I want to take this opportunity to recognize my team at the Iowa Department of Public Health, which includes, of course, Director Kelly Garcia, Deputy Director Sarah Reister, Dr. Caitlin Padati, Dr. Ann Garvey, and the entire EPI team, and Ken Sharp, who is the Division Director of Acute Disease Prevention and Emergency Response, and of course, the directors and staff of every single one of Iowa's 99 county local public health departments who are on the front lines every single day, making a difference in their communities. So a heartfelt thank you to all of you for your commitment, your courage, and your leadership, especially over this past year. I'm proud of what we've accomplished, and I look forward to continuing to work together to make Iowa one of the healthiest states in the nation. So as I close this morning, I did want to provide a brief update regarding the Anamosa State Penitentiary and the tragic event that occurred there on March 23rd that took the lives of 2 innocent public servants. It was horrific and evil. And let me again assure Iowans, and especially those who work at the Department of Corrections, the security of our prisons and the safety of our staff are our highest priorities. A comprehensive internal investigation is already underway, and Director Skinner announced to her staff last Friday that some changes would be implemented immediately. The department is creating a new position, the Director of Prison Security, which will solely focus on assessing and improving security across all facilities, and that will be a direct report to central office. She is also holding feedback forums, and they're being held at each prison so that staff can openly voice their concerns to the department leadership. In addition to the internal investigation, we'll also conduct a thorough external investigation, and we're working with Director Skinner to initiate that immediately across the entire department. So together, we'll address any issues the investigations may reveal, and we'll do what's necessary to protect our people. Nothing is more important than that. Changes may require additional investments, something that I am fully committed to doing, and this includes making sure that the department and its facilities are adequately staffed. At the current time, the vast majority of positions within the Department of Corrections are filled and funded. Department-wide, we have 93% of the positions are filled and funded. 5% are in the process of hiring and are funded, and then 2% are unfunded in the current fiscal year budget. The budget that I did propose in January included an additional $5 million of funding for the Department of Corrections, as well as the community-based corrections system specifically intended for salaries and staffing. The budget that I proposed was ahead of any of the changes to the AFSCME contract through collective bargaining, and as is customary. My budget never assumes changes due to the collective bargaining process, and again, that's as customary. As the investigations continue, I will keep Iowans informed about their outcomes and the next steps that we'll be taking. And with that, I'll open it up for questions.
Governor, you have used your authority to involve Iowa in the national lawsuit challenging a tax provision in
Yep.
the American Recovery Act.
Yep.
Do you intend to hold off on spending money that the state will get from the American Recovery Act until that legal action is resolved?
No, well, we asked Secretary Yellen to clarify that. We weren't happy with the clarification that she put in process, and that's why we moved forward with the other states to challenge it through litigation. At this point, we believe that removing the triggers and moving forward with the tax credits, or tax cuts, are funded through existing revenue, and it's not inherent on any of the funds that are coming in through the recent COVID allocation, but it's still okay. We're waiting for guidance from Treasury. We haven't received anything yet, and so all of our agencies are holding tight until we get clarification on what that guidance looks like. So in the interim, we're kind of walking through what we potentially could use some of the funding for. Of course, that's based on what the guidance requires, if there's any maintenance of effort, and just all of those things that goes into funding that comes into the state. So we believe we're still okay to move forward, but we'd like that clarified. That's why we joined the state. We didn't think that the response from Secretary Yellen was sufficient and really answered the questions that were asked by many governors across the state, across this country.
Governor, how do you define vaccine passports, and what kind of issues would you use legislation to address it?
Well, I'll sit down with the legislature and do that. Otherwise, we'll do it by executive order. But I think there's all kinds of questions that are really raised with moving in that direction. Privacy implications, HIPAA, First and Fourth Amendment rights, Americans with disability. I think what you're doing when you move forward with something like that is you're creating a two-tiered society, and it's that you either engage or you're marginalized. I think, what are they doing with the data? It is more big government overseeing what's happening, and so we want to make sure that doesn't move forward in the state of Iowa, based on what they would do at the federal level, and we're not alone in doing that. Other states are taking similar steps.
And would that affect businesses that want to have some kind of vaccine
This would be
verification?
we're taking a look at what the verbiage will look like as we move forward. So we're still working through that. We'll be working with the legislative leadership, or as I said, if we're out of time, we'll move forward with an executive order.
Is Anamosa understaffed?
Well, that's what the review is going to help us identify. Right now, they are, I think I said 93% of the FTE, of the total FTEs that they've been allocated is funded and filled. So currently it's filled. 5% is in the process. 2% of the total FTEs are not funded at the current time. But, so they're doing an internal evaluation, which is good, and they're already making some significant changes. But in addition to that, we've worked with Director Skinner, and we're going to bring in an outside team to do a thorough investigation of all the facilities and just look at several issues moving forward. So we'll do Anamosa, but we're going to also have them look at the other facilities as well.
And where are the 2% unfunded?
The funding hasn't been there for 2%. They're just not funded with the allocation that they've received.
Governor, how do you balance keeping kids in school and the UK variant, the dominant strand in the U.S., spreading among kids who can't get vaccinated?
Okay. Well, right now, first of all, we've had kids in the school, and majority of the kids in the classroom since August, and educators across the state have figured out a way to do that safely and responsibly. And there's a whole other host of issues that these children are dealing with when they're not in the classroom and receiving the education and really the safe environment, a hot meal, and all the other social and emotional impact that it has on our kids when they're not in school. Teachers, for the most part, have been eligible for the vaccine. They're continuing to take mitigation efforts to help protect the children. And I am not aware of any school district in the country that has pointed to a significant outbreak that is a result from transmission in the classroom. I don't believe there is a specific case that's been highlighted at this point. And even within Iowa, when you talk to the educators in the different schools, when they were doing the contact tracing, most of the teachers or the kids were being exposed outside of the classroom. We weren't seeing the transmission inside of the classroom.
Would that include Iowa City? Because I think there's like 500 students out now and 22 staff members, and they're out because of quarantine.
Yeah, but
do you think that's not
did
within
they have where was it? Have they done the contact tracing?
Well, no, I would ask you that, I guess. Have they done the contact tracing? That would be a
Well, we're still doing contact tracing, so that's still happening. They still can, same procedures still in place, David. If they wear the mask and they're in the classroom and one of the students tests positive, if they've had, if all of the students have been wearing a mask, then not all of them have to quarantine. I can look at that and get back to you, or you can call them and find out. But we're not seeing significant, to date, I have not seen any, we haven't seen any classrooms that have indicated that it was happening in the classroom. Certainly not the majority.
Yeah, do you sense, I think Dr. Walensky was talking this morning about concerns that this new variant does seem to have more of an impact on youth. And I think she's talking about youth sports. Maybe some states that are having high numbers of cases should maybe discontinue youth sports.
Well,
so it sounds like there is a concern that youth may be more involved in these new variants.
Yeah, well, and we'll monitor that like we do. We're monitoring it every day, and also which one was just approved for students, Pfizer, was it Pfizer? So we're going to continue to see vaccines and new data come in, and that will be eligible for students that want to get the vaccine. So that dynamic is changing every day. But we also went through a softball, but that was not with the new variant, so we'll continue to monitor that. But we also, again, proved with the first round this summer that kids could play sports, both softball and baseball. They could do it in a safe and responsible way, and I think it's been a while since I've looked at the statistics, but I think about 90% of the kids that started were able to complete, and they were able to do it in a safe and responsible manner. I just had a bunch of Waukee kids at the Capitol today that had the opportunity to participate in dance and golf and basketball, and I bet the majority just couldn't thank us enough for getting them back in school and for giving them the opportunity in a safe and responsible manner to have some sense of normalcy and to be able to play sports and to get an education and prepare for their next step in life. So we want to make sure that these kids have every opportunity to be successful. And I tell you, my heart goes out to the kids that are still not in a classroom, still not getting the education, a safe environment, and the resources that they need to be successful. And we're going to see the outcome and the backlash of this for decades. And some of these kids will never recover from it. And so we need to that always needs to be part of the question and part of the conversation when we're talking about the impact that this has on our children.
Thanks, everyone.